our final speaker today, Dr. Sheila O'Keefe-McCarthy. And Sheila, while you're bringing up your slides, I'll be reading your introduction. So Sheila is an associate professor in the Faculty of Applied Health Sciences in the Department of Nursing at Brock University. She is a nationally certified expert in cardiovascular critical care and holds the National Research Director for the Canadian Council of Cardiovascular Nurses. She's also a scientist at the Centre for Research Across the Lifespan and the Brock-Niagara Centre for Health and Wellbeing in St. Catharines, Ontario. Her research program includes patient-focused clinical research in women's and men's cardiovascular health, education of patients, healthcare providers, and trainees, and extending reach to create awareness and mobilize knowledge to improve the promotion, prevention, treatment, and understanding of the human experience of cardiovascular disease. So thank you very much for joining us, Sheila.
Thank you very much, Fiona and Perry and Dr. Joel Katz and the Canadian Journal of Pain for inviting me onto this amazing webinar. I very much appreciate it. It's my honor to be able to share with you the 23 narratives of men and women as they have lived through the recognition and pain and symptom realization of the early warning signs of cardiovascular disease. So I want to talk to you just very briefly about some of the actual research findings, the methods that we used in our approach to analysis, and then discuss some of the highlights in terms of the potential transferability and relevance to pain science. Rising around you like a wave of cold heat, surprisingly unpredictable, unexpected, gripping talons of pain, ripping, digging in flesh, searing, piercing pain from inside out. I can't breathe. Am I dying? I'm dying. A sadistic volcano turned inward, erupting like acid, digging at you, gnawing away, stripping me raw, penetrating, incapacitating pain, exposed raw, vulnerable. This unrelenting pain, it's not going away, not getting any better. These were the verbatim words of 23 men and women in the throes of encroaching chest pain, an early warning sign indicative of obstructive heart disease. Unexpected cardiac pain was described as coming in waves of cold heat with varied descriptors and qualities. One person said, well, it was pain, yes. What number on a pain scale? 10. Enough that it required me to breathe to control the pain. I felt like it was probably a 7 or an 8. About half of the sample referred to pain as pain, or squeezy pain, a heavy pressure. It was uncomfortable. One said it was gripping, digging, ripping, searing, a burning acid, as you heard in the raw pain, a thematic poem created from this actual data. This is a watercolor that you've seen by artist Kaylee Tyler, who shared with us her ideas and thoughts as she constructed this actual creation. The blue signifies the coolness of pain, she says. She is floating in the pain that surrounds her. The red strips indicate the pain is stripping away at her, and the red drips that run down represent the heat of pain slowly taking over her body. Pain experienced from an acute coronary syndrome, unstable angina, or a myocardial infarction or heart attack is typically reported in the severe range. Ischemic pain, whether or not it's those early warning signs or in the acute phase, have various different descriptors in clinical practice: chest pain, discomfort, tightness, heaviness. It's very individual. Prodromal symptoms are specific and non-specific symptoms that men and women experience months, weeks, days prior to their actual heart attack, but they're extremely difficult to recognize because they vary in degree of intensity and the frequency. They're very transient in nature, and they're very difficult to recognize because they leave once the event has occurred. Early recognition of those prodromal ischemic symptoms are imperative to stave off morbidity and associated mortality. We are well aware of early pain detection and treatment helps to circumvent transition from acute to persistent forms of cardiovascular pain. So it's all the while, it's very important that, increased recognition and meaningful uptake of this knowledge is conveyed, but perhaps using artistic and creative, concrete ways is an avenue for us to think about and hasn't been well explored in terms of knowledge mobilization. So we do this purposefully. We use an arts-based integrative approach that combines the strength of qualitative inquiry. And what this really does is it enables us to create knowledge by transforming those individual pain narratives into, in this case, poetry and art, which represent the emotional dimensions of their pain-related experiences. So we've been purposeful to wanting to describe the initial early prodromal pain symptoms and the feelings associated with adjusting to this new cardiac health-related concern. We use arts-based, embodied, layered exploration to analyze and interpret and to represent and then to disseminate this actual data. We did it in 4 layers. Layer 1 involved qualitative description of those rich participant descriptions, looking at what they've actually said, looking at content analysis to categorize them and then develop them into themes. We took another level of layering in terms of literary interpretation and constructed thematic poetry, looking at those illustrative words, listening to the silences, the subtle nuances, the tenor of the words, the weight of the words, the quotes, and putting them into stanzas. We read it in an embodied recitation to possible artists to do representational mediums of visual art to further open up the data in terms of the description of pain to create and represent the data. And the 4th layer was performative and an art exhibit, if you will, to create that level of knowledge mobilization. There were 3 overarching themes: denial and disbelief, encroaching pain, which you've heard the first poem, Raw Pain, and Symptoms of Heart Disease, and self-recrimination. We were able to create 4 thematic poems and 6 artistic pieces. Denial and disbelief was one of the actual themes. A person shared with us, "I woke up with a squeezy chest pain, a constant pain, not overly painful. I remember thinking, oh my God, I'm having a heart attack," and then thought, don't be silly, no you're not. And I can go back maybe 9 months from that episode. I had a little bit of heartburn or something, and this one was not going away. The poem Warning Signs Interrupt Us tried to get that theme across. For some, the process of recognition was attributed to those niggling, repetitive signs that were perceived as creeping all around one's awareness, yet elusive enough to be disregarded. Participants discussed that they could no longer use denial as a mechanism to cope. The nature of the pain was so persistent and consistent that it totally interrupted their life. In response to this, artist Melanie Prentice was able to create this charcoal drawing to further represent the interruption of warning signs. This artist narrative and metaphoric depiction deepens our ability to connect with the participant experience, thus opening up multiple ways of understanding the meaning in the original data. The actual artist shared this narrative. "I found Warning Signs Interrupt Us incredibly powerful. It was relatable. I chose to use white Conte and charcoal on dark paper to suggest a ghostly presence. The poem is very chilling, and the themes of fear, death, and paranoia are very consistent." The second piece is created by artist Lynn McCleary, titled Hidden Warning Signs. She shares with us her process in creating this collage that represents the mixture of trying to grasp that something is very wrong, that something is changing, and yet not having the ability to be able to accurately identify where the specific problem lies. She shares with us the process of creating this collage involved creating layers and pieces of women's bodies, warning signs, masks, and the death images. These images became convoluted by the layering process with warning signs more or hidden or obscured. Running on empty was the second overarching symptom that was alongside cardiac pain. Running on empty was the poem that depicted this actual experience of unusual fatigue. Lynn McCleary was able to craft pastels on paper with robust balloons and then the waning energy leaving one's body. The third overarching theme was coming to the experience of the realization that ischemic prodromal early warning signs meant the development of heart disease. And for most, all of the participants had expressed an irritation and an annoyance with self. Participants described retrospectively feeling so foolish that they hadn't recognized that their symptoms related to anything cardiac in nature. Most of them also talked about being so happy that they didn't come to a fatal end and that they were given a second chance at life. I coined the poem Lucky, which is a quizzical, humorful poem in order to relay the underlying use of humor that some participants employed to help them deal with their lack of timely recognition of heart disease. This was crafted by Jean Abernathy, a digital cartoon that expresses these thoughts. This study contributes to qualitative pain inquiry through the use of arts-based approaches because it represents the perspective of the acutely cardiovascular ill in terms of their pain. Purposefully, we built on the aesthetic experience as a method of knowledge dissemination to make visible the emotional dimensions of that cardiovascular pain because it weaves together the benefits of art and science. They both have the ability to illuminate aspects of the human condition with deep roots in level of inquiry, exploration, examination, and that revelation and representation that enhances the individual's understanding of their relative pain experience. And so there is tremendous reach in terms of public scholarship and knowledge translation of qualitative and arts-based research in terms of research creation. This is an actual video of one of the actual events that we had where we did augmented, I don't know whether it's going to work or not, augmented levels of analysis where we were able to take it to another level of photographic thematic analysis. We were able to present a couple of art exhibits. One was at the Canadian Pain Society, the annual meeting in 2019, which we were delighted to be part of. So just, you know, in conclusion, employing an integrated arts-based approach provides the aesthetic translation, if you will, of patient narratives of their early ischemic cardiac pain processes in the recognition of coronary artery disease. And what it does is that it's purposeful and intentional in that it causes the ability for us to relook, or it disrupts our notions of how we might have understood or come to know about what a pain might look like in certain patient contexts, and switches our focus to that of the actual patient and their the importance of what they adhere to, how they see their own multidimensional pain experience. This form of artistic scientific dissemination has the potential to transcend the barriers of language. It really enables us to see, hear, speak, and feel, understand, and remember what pain is like for an individual in the early stages of coronary artery disease, and perhaps most importantly, makes visible the emotional meaning of that related pain experience. So I want to thank you for your kind attention. I want to also thank my co-authors on this actual publication. Thank you to the members of my Heart Innovation team with all my graduate and undergraduate students, the participants in the study, and sources of my funding as well. And thank you so much for your kind attention.